welcome to a special edition of VLGA Connect in conversation today with Angus Clelland, the CEO of Mental Health Victoria. Angus, welcome to VLGA Connect.
Thanks, Chris, and thanks for the opportunity to chat.
Good to have you here. I know you've had a late night before we record this because of the federal budget. What are your first thoughts about the federal budget and how it will impact on the work that you're doing?
Look, as expected, it was big, but it only really paints half of the picture, if you like. There's a number of major reform processes underway through the Productivity Commission inquiry and the National Suicide Prevention Advisors inquiry and the National Children's Mental Health and Wellbeing Strategy and so on. And our expectation was that we get a partial response to all of those issues, and that's what's happened, and that's to be expected. The numbers, though, are very big, so it is historically large, the commitment that's been made. So it's an additional $2.3 billion over 4 years, which is a good start. But the main response and the main game really is going to be the budget next year, and it's contingent on a new national agreement on mental health and suicide prevention. So the way that mental health works is that it's a joint responsibility between the Commonwealth, states and territories. So states also have to do heavy lifting, and Victoria certainly is stepping up to the plate, and we'll see that next week on the 20th of May when the budget's handed down. But the rest of the jurisdictions have to jump on board. So exciting times, but there's a lot more to come.
As a result of what's been announced in the federal budget and what you expect might be coming from the state budget, what sort of impact do you see happening on the ground in the work that you're doing?
Well, there has been, I guess, over the last few years, a major shift in the approach to mental health and wellbeing service delivery. We're moving from an environment of a crisis response, if you like, and a big focus on people being served through hospital emergency departments and inpatient units. But if we look at the federal budget, the way it's structured, and also the Royal Commission report here in Victoria, the big emphasis, and appropriately so, is on community-based multidisciplinary care. The big I guess headline items in the budget last night were a large-scale expansion of adult and children's mental health and wellbeing centres across the country. So on the adult front, there's a $487 million investment in those centres. And we're particularly pleased with that because we initiated that program. We developed the initial service concept and pitched, to be frank, to the Commonwealth and said this is a good idea. And part of the reason for that pitch was that community groups and local councils here in Victoria were coming to us and saying, we need a multi-service hub, a mental health and wellbeing centre, a support service within our local government area to provide support to people when they couldn't get the help they needed through GP, but were not sick enough to meet the very stringent criteria for hospital. So there's a huge community need there, and the federal government has recognised that. So that's a terrific first step. At the state level, the Royal Commission has recommended the expansion of the very same thing. So between 50 and 60 of these centres will be rolled out across the state over the next 5 years. And it's a question mark of who funds what, between the Commonwealth and the state. But we'll see a very large scale investment in services at a local level that will really profoundly impact local communities, and local councils are key to the success of those enterprises. In addition to which, there'll be a large-scale investment at a state level in all of the LGAs in terms of the funding for community-based groups to come together and form around mental health and wellbeing. So I think there's 79 from memory.
Correct.
Each one of them will be funded to establish a local committee that can look at the mental health and wellbeing needs of the local community, and obviously do health promotion and all of those sort of things. But to be able to really tailor services to the needs of local community, and councils are front and centre of all of that.
Are these things that you're hearing councils say they need? Are these responding to a particular identified need?
Yes, it's there's a lack of service availability really across the state and across the country, I should say, and it becomes particularly difficult the further you move from the central business district. Really, yeah, as you push out past the inner suburbs, there are large-scale gaps in service architecture. It gets very difficult to get an appointment with a psychologist or a psychiatrist, and for many, they can't afford to wait weeks or months, and also they can't afford to pay the gap fees either. So part of the deal with both the Commonwealth and the state is that these new centres that are established are basically walk-in. No one is to be turned away, which is another good concept, a remarkable concept in terms of service delivery, but they're fee-free. So people can go there and get the support that they need. Now, given the scale of what we're talking about, there are huge workforce implications, and part of what the Commonwealth and the state are doing is looking at incentives for the attraction, training and retention of mental health workers. And the mental health workers are not just psychiatrists and GPs, they're social workers and occupational therapists and psychologists and so on. But we need to grow that workforce and also make sure that it's better distributed across the state. So incentives for people to work and train and live in regional Victoria is a big feature of all of this. But increasing the size of the workforce will be absolutely critical. We need thousands upon thousands of new workers in Victoria alone just to meet the Royal Commission requirements. So it will be a big growth strategy required.
Yeah, that's extraordinary scale, what you were describing there. And I think you mentioned 50 to 60 centres. Has it been determined where those centres will be as yet?
Funnily enough, after the Royal Commission report was released, let's see, on the 2nd of March, on the 3rd of March, the first announcement around where the first 6 would be located was released in places like Frankston and Brimbank and Ballarat and Bendigo, I think, from memory, but I'd have to check that. But we'll see really at least 10 to 12 of these rolling out each year over the next 5 years. But my hope is that once the program gets ahead of steam, that the numbers will increase and will bring them all online before that 2026, 2025, 2026 period when the Royal Commission has said they all need to be up and running and fully operational.
How do you see local councils intersecting with this work? What would you like to see councils doing?
Well, local councils, I think, are absolutely critical to the design and operation of these types of services. Unfortunately, councils are often left out of the policy and the planning side of things. They're a key partner that are, to be frank, are often overlooked. And there's a really big requirement for councils to get involved in these processes. State government's going to fund those local committees. They've referred to them as collectives in each of the LGAs, and that's a big part of it. Sounds a bit Marxist, doesn't it? That's a big part of it. But when we come to design all of these services and tailor them to local community needs, council needs to be at the table, and that's it's going to be a key part of making these things a successful enterprise.
You've been in this role for 4 years. Did you imagine when you started in this role that you'd be sitting here now talking about such a large-scale rollout of services and work?
No, indeed. And Mental Health Victoria didn't exist until 3 years ago. It was sort of built on top of a sort of very small organisation that only looked at a slice, if you like, of the mental health system. But we recognised that the organisation really needed to embrace the whole of the mental health sector. So that's the medical colleges, the unions, service providers, community groups, and so on, but also to work in coalition with a large number of other sort of powerful organisations, and police and ambulance have been terrific partners for us, national organisations as well. And what we really needed to do was to work in coalition to advocate for reform and investment. And some of the planets were aligned with things like state election and federal election cycles, but working in coalition has been incredibly important. And government does take notice when we've got 30 or 40 peak bodies and unions involved with us, and hundreds of other organisations. So taking that approach has been very successful for us.
Angus, it's a great story. We look forward to perhaps catching up with you in another 12 months or so to see what sort of progress has been made as all of this rolls out. But thank you for your time today on VLGA Connect.
Terrific. Thanks, Chris.
I've been speaking with Angus Clelland. He's the CEO of Mental Health Victoria. Big things happening in the space and an important role, as we've been discussing, for councils in all of that. Thanks for listening and watching this special edition of VLGA Connect in Conversation.